Please don't keep us a secret. Tell everyone about Vosita Telemedicine. Social distancing friendly and virtually free. Vosita Telemedicine. Give Vosita a try.
Thank you so much for joining us, joining our weekly meeting during this emergency time. This is my contact information. My name is Robert Gabriel, President and CEO of Microice Technology, and also President and CEO of Vosita Telemedicine. I also have a couple of people who's going to help me today, especially when we get to the telemedicine coding. Amir Gadalla is the RCM General Manager, and Nesma Abdelaziz, she's the RCM Team Leader. Just a couple disclaimers. Microice or Vosita cannot be held responsible for any loss of revenue or data or the health of the patient. You need to verify the information yourself or anything you learned today. This is today's agenda. The first item we're going to talk about is Vosita version 1.1, the newest features. And just in case if you don't know about Vosita, let me tell you a little bit about it. I created Vosita and I'm donating the technology and the software for your use as a provider at no charge to you until March of 2021. So hopefully the whole chaos with the COVID-19 will be over by then. Now, when I created the Vosita, I didn't have in mind that this is going to happen because I've been working on it for over 2 years. It was supposed to be able to book a virtual visit, which is telemedicine, or a regular visit. So I designed Vosita to help providers market themselves, show their availability for a normal office visit or for a virtual visit. It can help you book existing patients or find new patients for your practice. The patient will be filtering either by zip code or filtering by specialty or filtering for what insurance plan they're looking for and pick between virtual visit or regular visit. I see here there's providers that actually have normal office availability as we're speaking. Just to show you what's happening here. So I'm searching for virtual visit. I could have filtered for specialty by dropping down the list and pick a specialty, or I could be filtering for zip code or for a particular insurance plan that the patient will be looking for. Based on the area that I'm in, it shows me the providers that already signed up. I can pick a provider from the list as a patient. So I can just click on an appointment and just, this is a real doctor, this is a real appointment. So I'm not going to really book it. So I'm going to go back to the beginning and just show you. Or you can choose like a shortcut. And let's say if I'm looking for a pediatrician, and I can filter census who's around me, or I can filter for a particular zip code. There is providers that actually seeing patient in the office. So we will talk about that today. I'm going to get a survey and see who's open and who's not. So let's talk about the newest features in Vosita. Vosita was released only 6 or 8 weeks ago to the public, and based on the feedback I get from providers that use it on a daily basis, we're trying to enhance the program to meet your need and give you the best experience with the patient and operating your office. So I'm logged in here as a provider. As a provider, I'm going to click on my dashboard. So some of the features that we added based on your feedback is the number one. If you notice here, if you've been using Vosita already, we put colors and we added an extra button. So some providers were not getting to the schedule appointment on time. And it was expiring and was moving to past the appointment. So what we did is we're not pushing it to past the appointment until you hit done. So you have to hit done for this appointment to move from this list. Think of this as your virtual waiting room. And this waiting room, you will see all the patients are logged in or waiting for you to be seen. You get to see all the appointment, regardless if it's now or 5 minutes ago or 2 hours ago, until you hit done to move it to the past appointment. So you can, as a provider, you can start the appointment at any time by hitting the start. The patient has to be ready for you. And when you're done, you hit done. So so this is the new features that we added. Now, the other features that we added is when you click on the name of the patient, it gives you a hyperlink. And that hyperlink, it will show you information about the patient, date of birth, name, and email, and phone number. There will be other things added. We also added the insurance card. So if you click on the insurance card, you get to see the insurance card here. And if you download the insurance card, So you will be able to open that card. So it will show you here what the card look like. Okay, and you can print it if you want. So those are some of the new feature. But the most important feature is really the feedback we've been getting is provider wanted to invite a patient with one click and didn't want it because some patients are having a challenge to either create an account or to create an appointment online. Even that creating an account, creating an appointment is not a big deal. But the feedback that we got that most people wanted it to have one click to invite the patient. So I'm going to demonstrate that for you right now. Click on virtual walk-in. Then the virtual walk-in, you're going to see this is how it shows you how you're going to look in the camera. It shows you what is the speed that you're getting. Then you're going to, when you're ready, you're going to hit close. Then you're going to hit invite. So what you need to do is you need to send invitation to the patient. So you need to enter their phone number. So I'm just using one of my cell phones just to show you how it works. Okay, and you're going to hit invite patient. The patient is going to get a text. So I'm going to play the patient and the provider at the same time. So you're going to see me twice, just in case if one is not enough. So the patient is going to click, and once the patient connects, you're going to see this button here turn into a dark blue. So when you click on it, the patient is going to accept. Now you see me twice, one as a provider from my computer and one as a patient from my smartphone. So that's how simple it is. That's what everybody was asking for, and I'm proud to tell you that I have it ready for you. So I called it a virtual walk-in. So regardless if you have people booked an appointment or not, this is your normal appointment booking, like the virtual waiting room. And this is now a virtual walk-in where you can just invite a patient with one click of a button. I'm very sure this new feature is going to make it much easier for you and for your patient to connect and be able to bill at a higher level, because now you have a full telemedicine where you have the audio and the video. Also, the new mobile app has been released for the Android and for the iPhone, iPad. So you can either download it from the website or you can go to the App Store and download it. We also added new features where the account holder can create appointments for their children or dependent. I'm not going to go through that now. It's easy stuff. At the bottom of the page here, I do have a place for training. So if you click on it, so there's video trainings here that you can go through and watch how you will be using Vosita. You can send some of this to your patients because some of them are patient related and some of them are doctor related. So it's very simple. Most people are able to do it on their own. When you sign up and you create an account, we normally respond during business hour. We respond within less than 30 minutes. After business hours, it might take 8 or 10 hours to approve. Let's go back to the presentation. So we talked about the new features in the Vosita version 1.1. We talked about the virtual walking and how to invite a patient with one click of a button. Then we also going to talk about the coding. Okay, so now I want to introduce Amir Gadalla and Nisma Abdulaziz. They're going to give you any updates on telemedicine coding. And if you have any questions, you can unmute yourself and ask questions related to the coding. Then we're going to talk about the additional funding that's available for telemedicine. Right, so Amir, Nisma.
All right. Hi, everybody. This is Amir Gadol. I'm the General Manager for RCM at Microise. I hope everybody's safe during this time that we have. Nesma is going to help me today in introducing to you the latest update, how to bill for telehealth. Basically, there weren't a lot of changes that recently happened in the past, I would say 7 days. In the beginning, when we first started this, we've seen a lot of changes, but recently everything has been almost the same. So Nesma is going to help me today introduce to you how to use telehealth or how to bill for it. We're going to explain to you today. Nesma, please start.
Hello, everybody. My name is Nasma. I'm the RCM team lead at Microwise. I hope everyone is staying safe. Today, I'll be talking about the telemedicine codes and telehealth, what needs to be done and how to code for it and how to bill it. To start, we do actually have, or Medicare nowadays, like allowed 4 groups of telemedicine code. Thing that we have is actually the telehealth services. Those actually are the same exact thing as the in-person E&M visit. So they replace the face-to-face E&M visits. So if the provider is doing those services in the office or a nursing facility or a hospital, any type of those E&M visits, they can now be replaced by telehealth visits. They can be used for more established patients. So it's not necessarily that the patient is already have like a previous relation with the provider. They can be new patients. And one thing for the provider just to take care of it, just to make sure that there is a verbal consent of the patient that they agree to doing the telehealth services, exactly as the same thing when they come to the office. How to code for it? It's the regular codes, like the regular E&M codes from 99201 to 99215. If it's inpatient, it's going to be the same codes. If it's a nursing facility, it will be the same codes. The place of service that will be used is the regular place of service, 11 for office, 32 for nursing facility, 21 for inpatient, or 22 for outpatient, depending on type of the code that it's used. There is a need of using a modifier 95 just to differentiate between if the services are done as face-to-face or if the services are done as telehealth. So we use the regular place of service and we use modifier 95. If actually the visit resulted in the patient is impacted by COVID-19, to actually advise the patient that they need to take the test for COVID-19. So there should be the use for another modifier, which is modifier CS, to make sure that Medicare or some of the other payers would pay 100% of the allowable amount, and there will be no cost sharing for the patient to pay. So only the visit would result in a COVID-19 test or evaluation of a COVID-19 patient. There should be a use of an additional modifier, which is modifier CS. So the insurance would actually pay 100% of the allowable cost. The E&M level is actually determined by the time spent or by the complexity. So it depends on how you would evaluate the patient normally in your office. It's the same exact thing when you evaluate through audio and video. So that's the first part, which is the telehealth. The second one is the phone-only services. So the phone-only services, that would be the next slide. Those are the telehealth services codes, like the office visits and the time. There is the non-telehealth services, which are part of the telemedicine services. There's phone calls, like if the patient, they don't have like video, or if the provider don't have video, so they can actually do a phone call with the patient. It can be done to more established patients, and the codes will be from 99441 till 99443, depending on the time that the provider would spend talking to the patient over the phone. And the use of the phone E&M codes, or the use of any non-telehealth services, there is actually a restriction that the provider did not see the patient 7 days prior to the phone call or the virtual check-in or the online digital E&M, or the provider is not planning to see the patient 24 hours post doing those services. As for the place of service, it's the normal place of service and there's no modifier required. That's for the phone-only services. And then we will be having the virtual check-in. The virtual check-in, it's actually for more established patients. That's something like checking with your provider about your case, like sending like images or videos or like any information about the case, so the provider could determine from it what is exactly needed to treat you. And those code actually, it is two codes. One is G2010 and the other one is G2012. It's also depending on the time that the clinician spent reviewing the patient case. All of the non-telehealth services, they actually don't require any modifiers. We only use like the regular place of service. Just to be honest with you, from what we've seen when billing for all of our providers, all of the providers would actually care more about the telehealth services and the phone calls. This is what they use the most. So I'm open for questions if you have any questions for me. Thank you all.
Thank you, Nisma.
Okay, so I hope with the Vosita, that one click, you're able to invite a patient so quickly without have the provider has to reveal their personal cell phone number. You're able to see the patient face-to-face and get a higher payment because the full televisit, which is you can see the audio and the video, they pay much higher. And during the emergency time, the way we understand it is you're able to build the same normal place of service as you would see in the patient under normal circumstances. So now you can do televisit and just add the modifier, and you keep the same place of service as if it was normally. So I'm hoping now with the one-click visit through Vosita, you're able to use more of a full televisit, so you can bill at a higher code during the emergency time. You will be using it as a regular place of service, and after the emergency time, we'll go back with a place of service or two. And obviously that paid at a list, but I want you to utilize the telemedicine full video and audio together so you can get the highest amount allowed.
I have a question.
Raise what? Yes, go ahead.
Yes, this is Dr. Hoskin.
Hi, Dr. Hoskin.
Hi, how are you?
Great, thank you.
Nesma, you mentioned that with the phone-only services, you gave those codes, and you said no modifier was needed. So
Yes.
we shouldn't use the CS modifier if it's a COVID-related phone call.
This is Abraham. Hi, Doctor.
Hi, Abraham.
So I was wondering about that myself. There's no mention anywhere in the guidelines about that. No one's talked about it. I haven't seen any of the forums, and and at least not the last time, a few days ago. I would still add it. It was just to be sure, because that way, that we know, that make sure the patient doesn't end up not having to pay, or you get stuck with the difference. So I think I would still add the CS. I don't see how that would harm you.
You mean for the phone visit you're talking about?
Yeah, if it's if you're going to advise the patient, if you're going to advise the patient to go in to get a test, I would add it. That way, make sure
Okay.
This is Dr. Vosu. You were mentioning inviting patients.
Mhm.
Clarify that for me. Inviting patients, it's you reach out to the patient to make a televisit.
I don't know the exact workflow that you're having, but let's say if a patient calls you and says, I want to see the doctor, I don't want to merely make an appointment online where I can come to your office. So all you have to do, so let me go back to so this is my dashboard as a provider. So I'm going to go here and click on the dashboard. So I'm logged in here on Vosita as a provider. So you're going to click virtual walk-in. So then you're going to see how you're going to show up on the screen. Then once how you're going to look up on the screen, you're going to click invite. You're going to put the cell phone number for the patient. The patient is going to get a text. Click on the text and boom, you're connected with the video and the audio with the patient. You don't have to give them your cell phone number. They have to give you their cell phone number.
So this is when the patient doesn't have the time to come in and doesn't have the time to set up teleconferencing. We reach out to them. Hopefully we can work out to see them. Is that
exactly
what for? Okay.
Yes.
And the modifier 95 was for telemedicine that's non-COVID related?
Actually, for non-COVID related and COVID related, for any telehealth services, you will need to use modifier 95, but it's actually if it's a COVID-19 related, so you would need to add another modifier, which is CS modifier.
So it's both 95 and CS for COVID?
Yes.
Correct, yes.
Okay, now what is the difference? Once this March 2021 comes and goes, then what happens as far as cost of this?
There's always going to be a free version. So the free version is going to be just setting up a profile for yourself and just to have appointment where patient can book you in your office. So let's say patient will be, going like that. They can discover you. Maybe they're looking to see, I want to have a pediatric in whatever zip code they are, and you will be listed here as an office visit, and they can just make an appointment. This is going to be free. It's free now, and it will be always free. Then I'm having two other plans. I'm having a gold and I'm having platinum. The gold is going to include appointment confirmation. So you will be scheduling patients to get confirmation when they make an appointment. So that's going to be at a small cost. Then the platinum is going to be the telemedicine, where you get all the features, including connecting to the software like Medisoft or Lytec or other software to be connected to your appointment. So when a patient makes an appointment here, it shows up in your schedule on Medisoft or Lytec or any other application you're using. So that will be the platinum, and the platinum will have a cost after March 2021. But for now, all levels are free and there's no obligation. If you want to use the platinum now, then you want to downgrade only to the silver later on, where you just want to have your normal office visits and market yourself. It's not going to cost you anything. Where you have a listing online, it actually benefits your website and promote you as a provider, unless you're not looking to gain any more new patients. So that will be always free. Does that answer your question?
Yes.
Okay.
What do you predict the cost will be for platinum when the time comes?
For platinum, it's going to be anywhere between $100 to $200. But again, for now, during the emergency time, I'm donating the software. There's no cost for you now. For the patient.
That's nice. That's very nice. That's good. That's good.
Robert, this is Dr. Hoskin again.
Hi, Dr. Hoskin.
If your partners are using a different software, I have not been able to get the software for telemedicine yet because there was a glitch. Is there a problem if I sign up with MicroWise and they have a different program?
When you say my partners, what do you mean by that?
My office partners.
You could be using different software. You don't have to be dedicated only to one software. You can, you want to have as many tools as possible and you just do whatever works.
So in order to set this up, we would just call your office?
No, you just, it's a self-service. I do have support that can help you, but it's really simple. You will go to Vosita here. Let me log out. So if you are a provider, you will come to this site and you will just click on login. So when you can sign up as an organization. Organization could be like a big practice with multiple providers. So you can log in as an organization. You need to get approved first. Then you can add as many providers as you want. Or if you're solo physician, you just click on provider and sign up as a provider. Okay. So you just fill this, then we'll have to approve you. Or if you were a patient, so you will just click here and sign for the patient. For now, the mobile app is only for the patient use. The next release, which is in about probably next week, the doctor will also be able to use the mobile app to see the patient. For now, is the provider has to log into the computer to be able to do the virtual visit. Or the telemedicine. And I would love to hear your feedback. I am here for you, and I want to improve this. I want to make it the best software available.
Awesome. Thank you.
Okay, you're welcome.
Hi, this is Dr. Fernandez from Miami Lakes, Florida, and I've been using the system for about 2 weeks now. I have a couple of suggestions maybe or questions. One is when I go to look at my appointments, they're not necessarily in time order. And so I don't know if that's something that you can do in the future, just because I kind of go crazy to see which one's my next patient. So if they would be in time order, that would be very helpful.
Okay, that's a good suggestion. So when you're looking at your dashboard and they're not sorted in any time order.
Exactly.
I'm already working on that. That will be improved next week.
Perfect. I have Cerner in my office.
Okay.
You may mention something about this being able to like an office visit being transferred over to my appointments. Is that something that's free? Is it something that's going to cost? And is it possible?
Yeah, well, I want to interface with all softwares based on, I'm going to work with the majority. So if the majority has Medisoft is going to be first. Actually, Medisoft should be released within a couple weeks. The version that interfaces with your software after March 2021, that will be for cost.
Okay, got it. Thank you very much.
But if you don't get the integrated version, you're supposed to be getting an email to tell you that somebody booked you. Then all you have to do is just work the workflow in your office where you need to book it on your schedule manually.
Great. All right. Thank you so much.
Thanks so much for your question.
You having this.
Thank you. My pleasure.
It's Dr. Vosu again. I have a question again. Mm-hmm. I'm not completely familiar with telemedicine. I've been doing it for a week on doxy.me, and I'm trying to get a sense of this. The way I'm doing it is patients call the office, the staff calls me, and I say, okay, set them up for telemedicine. Mm-hmm. Tell them what my address is, and that's how it gets done. With this, it seems there's no intermediary. The patients know to make the appointment. How does it work from A to Z?
Yeah, let me show you a couple of ways. So let me show you one of our provider here. This provider, for example, has a link here for telemedicine visit. So you click on that, then that will take you to Vosita, and it will take you to your own calendar. So as a patient, I can click on this and I can log in as a patient and book her, and that will show in her schedule as a telemedicine.
I see.
So that now this is the normal way I designed this for to work. So you can link it to your website. So after you create your own profile, so let's say I'm going to use myself as a profile. I'm a fake doctor here. Okay, so this is me. So what you need to do is you need to take this link, give it to your web designer, and and tell them to link it to your website. So when somebody clicks on it, they're not going to see how big that link is. They're just going to click, and it's going to see you just like you saw Dr. Goldberg before by just clicking here, and you're able to connect.
So this involves the patient being familiar with your website and accessing your website, because most of our patients just have a phone call to our office, our phone number, they call the office. So these patients have to be savvy enough to go to the website, correct?
That's correct. That's why I designed the one-click connect for the non-savvy patients. For the non-savvy patient, you don't need anybody in between, or you can have somebody help you. So all you have to do is just click on virtual walk-in, check yourself on the camera to make sure you look okay on the camera. All you have to do is just click invite, and with the phone number for the patient, and you will. And the next version that I'm planning is you'll be able to look up a patient that you already have on file to invite them, so you don't have to even look up their name. So for now, as you type in the phone number, and the patient will go to text. They click on it, boom, they connect. So they don't need to download an app. They don't need to be computer savvy. All they need to have a smartphone that has a camera, able to hit allowed.
Robert, this is Kanu Patel.
Hi, Dr. Patel, how are you?
Of all the calls you make, do you have logs of all the correspondence you do on this one?
Yeah, not the virtual walking. So
not booking, but like say I want to look up God forbid some inquiry comes that how much time you spend with the patient.
Yes, so you will have, if you do a telemedicine visit after you had done, you will go under past appointment. You would see a link here for the patient profile or for the insurance card for the patient, and you will see here if it was a telemedicine visit, you will see duration here.
Okay, well, I'm glad you put the telephone contact that we can invite patient. I'll try it out starting Monday.
I did it just for you, Dr. Patel.
Yeah, I'll be out of doxy.me and I'll bring you a few more people in.
Okay, great. Thank you for your feedback.
With you here. Question is like if we are providing service at multiple locations, and how we able to keep up that location-wise the appointments and stuff like that.
Good question. So when you log in as a provider, so when you have your profile, you look at all the way at the bottom here, you can add additional addresses here, and each address, it will have its own scheduling.
So you guys will consider as a provider or more than one provider?
One provider can have as many locations as they want.
So the cost later on going to come
it's free. It's not, there's no additional cost for locations.
Okay, thank you.
And when you're creating your availability slot, if you haven't seen that yet, when you hit create availability here, so you will be picking which location. Even a virtual visit need to be, I'm linking it back to like a home base, like a location. I don't have a location called telemedicine. Each telemedicine has to be based on a location that you have. So if you have more than one location, you will be listed here multiple times. You pick it, then you choose if it's a virtual visit only or virtual and a physical. Then you choose, the range of days you want and the days of the week you want, the time slot, and what reason you want to make the appointment for.
Are we had to worry about the HIPAA compliance on this one?
Yes, it is. It is it's a secure link.
Do you have in-house training?
Yes, for Vosita?
Yes.
Yeah, the training is free. So just call us. We'll train you. There's no charge for it.
Okay. And just one last question. The complexity of the visit then depends on time and history taking, and physical exam, I imagine, is not part of this complexity and coding.
Hi, this is Abraham, doctor. So during the public health emergency, Medicare is saying that the exam and the history are not necessary to take into consideration for determining the E&M level. So they are following, for the most part, the E&M requirement, the E&M guidelines for next year, for 2021, in which case you would only need to use either the complete total time, which is alone, that's all you need, or the MDM complexity, one of those two. And the time is not, you don't need to factor in counseling or coordination of care. It's just total time, whether it's face-to-face or non-face-to-face, just add it all up and just get that time. So it's the same time, they're listed with the CPT codes, I believe, but it's just not, you don't need to worry about the coordination of care part. So you have the option to either use the full MDM, which is the current, either the MDM complexity alone, or you use the time alone. And this is only for this particular, only for the now this emergency.
Next year, you think it'll change once this emergency is over?
Well, hopefully the emergency will be over in a few months.
So Dr. King asked whether problem comes with some of the senior patients where they don't have video capacity. If they were to use the audio-only codes, which is 99441 through 99443, the compensation is going to be much lower than if they were to use the E&M codes. We have seen doctors actually that are now saying that they believe that in their interpretation of Medicare is that if it's a patient that is in such a situation who doesn't have the capacity, they are using the E&M codes. Now, they're admitting that it's their interpretation and of the Medicare guidelines. Of course, it's the emergency situation, so they're doing it. And this is a doctor in Dr. Jeffrey Heyman of in Brooklyn is doing it, and he recommends that he recommends that for his during webinars. So I just want to pass on what he mentioned. So what I would say is as follows: if you have an elderly patient, rural area where they don't have internet, use the telephone only. And as long as you can justify your records that you're providing the same level of care that you would provide if it would be an audio-visual, then just record that and from that fact that the patient doesn't have it and you're giving them the same level of care, and then use Modifier 95 as you would with an audio-visual and charge a regular E&M code. I mean, let Medicare come and, fight us for that. But I think that I don't, to me, it seems like a logical approach because you're doing the same amount of work and it's not your fault. He doesn't have video. So I would record that. He doesn't have video. This is what you're doing. This is your logic. And hopefully follow the exact same guidelines as if you had audio video with E&M codes and on Modifier 95.
What kind of visits the other physicians is not conducive with this? Are we just taking care of colds and sniffles?
This, you're talking about telehealth? Telemedicine?
Telemedicine.
Yeah. Okay, so this is the way I understand it. The government and the insurance payers, they're trying to protect you as a provider because providers are getting sick, and as we have provider getting sick, it's going to make the problem bigger. So to protect you and to protect the patient, they're relaxed all the regulation where you can see the patient through telemedicine without having the patient to leave their home and without having to put you or your staff at risk.
Any sort of visit, hypertensive, diabetics, who I haven't seen for a while, I can see those.
Exactly. This is how we understand it. Now, hopefully you don't bill for surgery or, I'm just kidding.
Right.
So in other words, this is Dr. Hoskins. So if you have a patient, say, who calls your service at 9 o'clock at night, your office is not open, you get the message from the service, you can schedule that patient to be seen that night, telemedicine visit.
Yes.
It can be used in that respect.
Yeah, and with that one click invite, you can just invite them on the spot.
Now, would you also use the after hours code for that if it's not within business hours? There is a code for that.
Abraham or Nisman, do you want to answer that?
I don't think it's a modifier so much as an additional code. Like you'd have the E&M code, and then you would have the next code, which is after hours.
I don't believe that the use of the after-hour codes would be actually required to be used.
With the telemedicine?
Yes.
No. Okay.
We could this is Abraham. I'm not familiar with that either, but we could look into that and get an answer to you.
I know that with regular office visits where the patient comes into the office, if you're not open on the weekend and somebody's sick and you're like, okay, I'll meet you at the office. It's not during office hours. You can bill them for the E&M code. And then there's an additional, I forget what the numbers are, but there's an additional code which you get paid for coming off hours. Just curious. Maybe
is that for a surgery? Is that for a procedure or that's for a regular visit?
A regular evaluation. Yeah, just
like an emergency visit.
Yes.
Or an urgent visit. Not really an emergency, okay. But yeah.
When this emergency is over, since I was not on telemedicine beforehand, what is the future of telemedicine as far as regulation? Is it going to be as simple to use, or are we just doing all of this for the next few months and come next year, it's just going to be very difficult to use and bring in money for it? Do you have any idea?
Well, I will only predict here. I don't know information for a fact, just based on the reason that I've been thinking about this idea for 12 years. and I started developing it over 2 years ago, even before any of this happens. Telemedicine is the future. During the emergency time, payers, they relax all the regulation. Relax means there will be telemedicine visit, but the coding and the place of service is going to be different. So under normal circumstances, your place of service of telemedicine is 02, and you're not going to get paid a full visit. Relaxing, they tell you, okay, you can use place of service 11 or any other place of service that you might be normally needed, like, and you're going to get paid the full amount, and all you need to tell us is document it as it was telemedicine and give us the time that it took and put the modifier when you're doing your billing. After the emergency, we're going to go back to the O2, so telemedicine is going to be always there. Now, the good news here is because of era that we live in, are all adopting to technology that maybe some of us would not turn into, and now we're forced to learn that technology and we're forced to use it. There will be what I call it the new normal in the future, where now if it makes sense for you as a doctor to see patient without having to go to the office, you can do that. And if I was a patient and maybe I do follow up with you and I don't really need to go to the office, in the future, maybe patient will be picking to do that without having to go to the office. So I see the future that this is going to be used, and that's why I developed this long time ago, or worked on it long time ago. I kind of had to rush it because of this, but I've been working on it for many years because I know this is the future.
I see this as the future of doctors getting paid for a service that normally they weren't getting paid for in the past.
Exactly.
So, yes.
Can telemedicine be used for completely new patients that we haven't seen in the office when we haven't had any face-to-face encounter?
Yes, it can.
So what you need to do is you need to work out the workflow, and maybe one of future, we've been meeting every Friday for the last 4 weeks now, or 5 weeks. And one of the upcoming events, I wanted to brainstorm about what is the best workflows working. How do you get your intake for the patient? How do you make the patient sign all the forms that you're doing now? So let me gather that information. If you have any suggestion, shoot me an email or shoot me a text. Then I want to do one of the next upcoming seminars about what is the best workflow that's working for you guys.
How do we set up a training before
just call okay, so the training that we do is online training. So we'll connect to your computer and do the training at no charge. So just call our number or call the Vosita number. So at the bottom here, just call that number and just push either 1 or 2 for Vosita for sales or support, and they will help you. So the number for Vosita is at the bottom here.
Question.
Yes.
Mental health? What's happening with mental health?
I think what makes the most sense, even without the COVID-19 or the coronavirus, mental health is really the best type of practices that can use telemedicine. It makes the most sense. But what are you using for everyday scheduling system?
We use MicroWise just for billing.
Oh, so you're using the RCM of MicroWise?
Yes.
Okay. So for the people that are using the RCM for MicroWise, the telemedicine and all levels of Vosita is going to be free. There will be no charge for that. So the next topic, which is I'm not sure exactly who qualify for this and who's not. So the source of this is from the fcc.gov. They're approving or they giving funds to people to use telemedicine. It's not for everybody. So this is what it says here. It's telehealth program limited for nonprofit and public eligible healthcare provider. So I'm not sure exactly what it means by public eligible healthcare provider. So there's an act there that it's showing. I tried to research it, but the requirement to qualify for this, you need to register with the FCC. You need to have an FCC number, and I registered for it myself. Of course, I'm not eligible as a vendor, and I'm not a physician, but I was able to register just to get a feeling of what will doctors have to go through to register. It was not that hard at all. And so please review this. There's a lot of frequent asked questions. So what I did is I took what I think most of you will be interested in because there was way too many questions. So I have 6 frequently asked questions I'm posting here for you. I'm just going to have the computer read it for us.
The COVID-19 telehealth program is open to eligible healthcare provider sites that treat patients whether located in rural or non-rural areas or U.S. territories. The COVID-19 telehealth program is limited to nonprofit and public eligible healthcare providers that fall within the categories of healthcare providers in Section 254H7B of the 1996 Act. 1. Post-secondary educational institutions offering healthcare instruction, teaching hospitals, and medical schools. 2. Community health centers or health centers providing healthcare to migrants. 3. Local health departments or agencies. 4. Community mental health centers. 5. Not-for-profit hospitals. 6. Rural health clinics. 7. Skilled nursing facilities, or 8. Consortia of healthcare providers consisting of one or more entities falling into the first 7 categories. For purposes of the COVID-19 telehealth program, which is authorized by the CARES Act, and not the 1996 Telecommunications Act, both rural and non-rural health clinics are eligible to receive funding.
Now, is this a grant? It's not a grant. This is funding. It's not a grant. You will have to submit invoices based on cost that you will have related to telemedicine. I'm going to show you a list of what they saying that you will be as cost and what's not. To register for something called the FRN, which is the Federal Registration Number, or the FCC registration number. So you need to have that, and this is the link of how you get that number and how to register. The next one is how can a healthcare determine if they are eligible. So healthcare providers seeking to participate in the COVID-19 telehealth eligibility determine, you need to call them up. This is the phone number, and see if you qualified or not. And if you qualified, you will start to accumulate invoicing and submit the invoicing and get the funding.
Are you sharing that number with us?
Yes, I'm sharing the whole slide deck with you. And you, of course, you can go to this link here, the fcc.gov, and go to the COVID-19 telehealth program. And you will see exactly the information that I'm sharing with you here, kind of summarize it in a few questions. So now, what's eligible, what service are you eligible, and what service you're not eligible. So this is an example of what you're eligible. So any devices that's, so from what I'm seeing where this is going is they want to have patient have devices where you as a provider can monitor them and be able to, but the device has to be connected to be eligible. So this is some of the example of connected devices. Now, what I'm not sure is it connected to you or connected to their device, to their, let's say they're connecting to their iPad or iPhone. Is it by being connected to, but I have a blood pressure device that I connected to my iPhone. Now, I'm not sure if I was a patient, is that considered connected, or it has to be connected to you as a provider? I'm not sure yet about that. And also what I'm not sure is, are you going to be administrating those devices to your patient, then then get the money from the FCC, or how is that going to work? I'm not sure about that yet. But once I find out, I will make some devices available for you if you want to use me as a source. And where I see the future is going to be, maybe you will have an exam room where the provider can see the patient in that exam room, and you have a medical assistant is helping you in that room without you being in that room. And that could be a virtual room that you have in your own office in the future. Or you might have a cart that you can take wherever room you are in, and that cart might have equipment for telemedicine. And from what I'm reading, those type of technology will be eligible for funds. But who is eligible to get that fund? I don't know yet. You need to find that yourself. I know if I know any more information, I will share it with you. The frequent question number 6 for me is your personal IT or your training or any cost like that. It's not, so vendors and any personal IT and stuff like that is not eligible as a cost. Any devices, including your internet connection, is considered as a cost under this. So there's a lot more to learn about that. Let's open the floor now for any questions that you might have for us.
Quick question again. When I first started on Doxy, about a week ago, one of the questions I had asked was about billing, and I was told that we can charge the patient either before or after the visit, depending on what we thought the time spent and the complexity was. That somewhere between minimum 25 to some number, and not, I haven't done many of them, but I wanted to see if that information is accurate rather than coding. Are there doctors, are there ways that it's legal to do that, that you say?
So let me ask you a question first. When you say we can charge for the visit, is that patient insured or non-insured?
I imagine the few that I've done, they have been insured.
They have been insured. So every payer is going to be different. So for me, for example, I have United. Even before the whole emergency thing happened, I received a card from United and I looked at the card and it looked a little bit different. It has now, so you know how a card always have how much you pay for emergency room, how much you pay for doctor visit.
Yes.
But now they have a new column for telemedicine. So there's a telemedicine copay now, which is, for me, is the same amount of copay as if I was in a doctor's office. For me, it was $20. That was the copay. So yes, it is perfectly legal to collect your copay. Now, what I'm not sure about, if the visit related to COVID-19, so is the patient is trying to screen to should go to the emergency room or not? Should they trying to ask you questions about COVID-19? If it's related to COVID-19, I know that Medicare they want to write off that. They don't want the patient to pay any percentage for COVID-19 related visits.
Well, honestly, some of them have not been COVID related. Maybe one or two have. And that's where I was confused. And
yeah, you will need to collect your normal copay or co-insurance.
You know, Robert, in Massachusetts, the governor passed the law. Every insurance company is going to waive the copayment and pay the doctor's full amount.
That's fine, but the question here, if it's not related to COVID-19.
No, but still, they have to pay for everything. And other thing is that some of the physicians are doing, I'm not sure it's totally legal or not, but they are claiming every visit right now they're doing telephonic or virtual is because of COVID, because the patients cannot come to their office. So because if there's a COVID, not COVID, then they would have come to the office. But right now they're not coming to office because of the COVID. So they're putting the modifier code, which they are putting the COVID diagnosis code. But it was impressive that Naseema showed that the CS code, which none of our team members were aware of it here. But that code can be put there because the patients are not coming to your office because of the COVID-19. Otherwise, they would have come.
That's true. That's true.
So from what you're saying,
right now you can do that because it's illegal.
Okay, so are we talking about any payer? Or we're talking about Medicare in general.
Any payer.
So any payers, you're saying that don't collect the copay because the insurance is going to pay you everything without the
patients are not going to give the money on the phone right now. And some of the patients may not pay you. So your billing people should inquire, but I'm going to tell our team at NICWA, which is running the whole show, to ask them too, because here in Massachusetts, actually, as such, the governor had declared emergency, so everybody's going to get paid full. Insurance company cannot charge copay for any kind of visit.
Okay, I think we have some researches to do. So Nesma and Abraham, can we research that, please, and have an answer next week in the next meeting?
So the right way right now is what? To submit a bill like 9921, whatever the coding is, because I was under the impression that you can charge the amount of the copay on a credit card, because Doxy gives you that option of collecting payment before or after the visit. And when I asked, they said, yes, you can collect before or after the visit. Not to do that?
We're not sure yet. We're going to research that. So I didn't think anything wrong with collecting a copay, as long as it's not COVID-19 related visit. But what Dr. Patel is saying, that insurance company want to waive all copays, I don't know how valid that is, especially if it's not a COVID-19 related. So we will do some researches and we will give you feedback. Now, when you get the EOB, it should tell you there if the copay and if it was me, I will collect the money. And if I have to give a refund, I will give a refund.
Okay.
Until we find out what is, if you're supposed to waive it or not. But from what we understand, if it's related to COVID-19 Medicare, which is, there's no straightforward copay, it's a co-insurance, only Medicare doesn't want the patient to pay anything related to COVID-19. We're not sure about other payers yet, but that should show in the EOB when you receive payment from the insurance.
Okay, well, thank you so much for looking
You're welcome.
into it.
I'm a hand therapist, and all of you seem to be physicians. I was wondering if you have this platform for therapists as well, and if I'm hoping that all the doctors out there will try to do something to help us as therapists. I've been doing a lot of webinars on our EMR that we use. It seems that Medicare does not want to reimburse us for the telehealth, but our patients are requesting it and demanding it.
I actually have a lot of physical therapists, they sign up for it. Me personally, I think if you can't see the patient and you want to walk the patient how to make movement, it makes sense to treat the patient through telemedicine. I can't control what gets paid and what doesn't get paid, but I see a lot of physical therapists actually signed up for it.
Okay, because our patients are really requesting it, and I'm listening to each day, it seems to change, but I was just wondering, because we used MicroWise years ago, I believe, before we had electronic medical records in our office.
Okay.
So it's a service that we always really liked. So I just want to find out more about it.
Okay. Well, we heard anything about physical therapists getting paid for telehealth yet?
What they're saying is we have to call each of our individual private payers. Medicare is basically saying no. They said if I were to work in a doctor's office, then they would pay for it. And if I worked in the hospital, they would pay for it. But,
so if you were part of a podiatrist or an orthopedic surgeon, you would be able to get paid for it. But if you are an independent PT office, they don't pay for it yet.
Right. And I'm actually an occupational therapist, and I'm a certified hand therapist. But it's just not. I mean, they said this whole thing about how much we're going to get paid and how often we can do it, and then they said, but we're not going to get paid unless we work in the media, like right in office. So I'm hoping that you as doctors will request this, because we could probably take some of the stress off of you. We're finding that our patients just seeing the whole methodology of doing the exercise in the patient's own home is great. Never even thought of demanding this in the past.
I agree.
Changing the way they do everything, and I feel like we can take the stress off of you.
I agree, especially for elderly patients. If you can coach them how to do the exercise and they don't have to leave their home, it's a win-win for everybody.
And my joke is I'm not great on the computer, and one of my 84-year-old patients taught me to get onto her Android system with Zoom. And I'm like, what? Okay, now I'll teach you your exercises.
Now, what's funny that they pay for transportation, okay? And it makes sense that they're going to be saving on transportation, and it's convenient for the patient. And now, I can predict that it will be allowed one day. I don't know when, but if anybody can put pressure on payers to make that happen, please do if you're on the phone with us or listening to this. So thank you for your feedback. Thank you.
Okay, thank you. Thank you for this webinar.
You're welcome. Any other questions?
Albert, this is Catherine from the Parenting Place in Wisconsin. And just listening to Michelle talk, I just wanted to put my 2 cents worth in on that. We do what we call birth to 3 services, and we have occupational, physical, and speech therapists. And in our realm, they are allowed to do teletherapy on our end but it's more of a government-funded program. So I think that's why we're allowed to do it.
I see.
But they're allowed to do the face-to-face via Zoom on our end. I'm not sure if that makes a difference, but I know that I looked at TRICARE on our end, and TRICARE does allow teletherapy or telehealth on their end. So I'm not sure what insurances don't cover it on Michelle's end. So just to kind of give you guys an update on that, I know that going forward, I'm going to be looking at the different health insurances in the Wisconsin side of things to see where we can get coverage on our end. Just wanted to throw that out for you guys.
So thank you very much. So you are able to do it, but you're part of a government-funded program, and you're able to do it.
Exactly.
So we need to find out, is there a way to bill it now, and Medicare pays for it, even if we don't have to put 11 as a place of service, maybe or 2, and so we'll do some researches on that, and if anybody has an answer by next week, when we meet next week, let's go over that, because it's a very important topic. Now, one more infomercial: if you want to operate and you don't have the capability to have your own staff to work remotely, we do offer what's called a remote employee service. It's only $475 per week for a full-time employee. Other than that, this is my contact information. Please share with me any suggestion or any questions. You can call me. And I want to thank you so much for joining, and thank you so much for your business, and have a wonderful weekend. And hopefully we'll get out of this as quick as possible, because it's becoming very stressful for everybody.
Please don't keep us a secret. Tell everyone about Vosita Telemedicine. Social distancing friendly and virtually free. Vosita Telemedicine. Give Vosita a try.